This presentation is part of the InteropEHRate demonstrations and presents how healthcare provider get exclusive access to the data of the patient. InteropEHRate has considered the main access of the patient to the healthcare services, either in the home country or abroad, and the two cases have been used for testing the development. One it was the healthcare visit and the other one it is the emergency access. In the present demonstration, we are using as an example the case of emergency access. In an emergency case, the condition of the patient might prevent the use of his mobile phone. An alternative has been found by using a patient emergency token that can be printed on a card or medallion for being used by the practitioner in such cases. We are presenting the case of a Romanian patient arriving in emergency to Fondazione Toscana Gabriele Monasterio. The patient is maintaining since a while the smart electronic health record on the mobile phone and has carefully stored a copy of his data on a cloud service that provided the right security level and is open to access through the InteropEHRate protocol. The data will be presented through a web-based application we named the HCP app that was developed as a demonstrator of the InteropEHRate protocols. After login, the practitioner receiving the patient has access to the main options and chooses the emergency case. The patient access token was provided on a card and the medical doctor decides to consult the data of the patient before future examination. Therefore, he presses Open Connection and scans the QR code on the patient card. The token is retrieved in the application and used to access the patient data from the cloud. Even if this connection process was quite fast, there are validation of certificates, communication processes, decryptions, and translations that are realized on the fly using the InteropEHRate protocol and services. We will present a few technical details later, but now we are showing the demographic information from the cloud that is confirming the correspondence of the patient with his data. For the ease of this demonstration, we use the source patient data in English, even if the original data would have been in Romanian. The interface and the healthcare data can be presented in different languages. Besides English being the project language, we used Italian, French, Greek and Romanian, these being the languages of the patient and users during the pilot tests. Once the demographic information was confirmed, the practitioner decides to analyze some more sections of the electronic health record and retrieve more sections such as current diseases. We may observe that the patient data is translated to the Italian language because the healthcare service is provided in Italy. Allergies, current medications, laboratory tests, and diagnostic imaging. An ultrasound image is found in the Smart EHR and downloaded for visual analysis. The imaging visualization tool used by the practitioner, it's an external application, in this case Oasis. Some more information like the heart rate at previous visits is presented in the vital signs section. The medical doctor decides that more laboratory tests are needed and introduces the investigation results, in our case, value of creatinine, and observations like blood pressure in the section for vital signs. A prescription is added, as well as details on the symptoms, results of physical examination, and diagnostic conclusion. A hospital discharge report is prepared. First, by verifying the information already inputted, and also by adding more information such as the reason of admission, discharge diagnosis, examination reports, and recommendations. Once the discharge report is completed and saved, the information can be printed as a PDF for being handled to the patient and also sent to the patient Smart EHR in the cloud. Later, when the patient has access to his mobile phone, he can retrieve the new information from the cloud and consult the discharge report on the Smart EHR application. This ends the demonstration part of the presentation, and let's have a look at some of the technical things in the background. The demonstrated connection followed the steps on the image, and these steps happened in less than a second. The InteropEHRate protocols were developed together with the needed services, the Health Record Index, the Certificate Authority, the Smart EHR Cloud, InteropEHRate Tools, InteropEHRate Health Services, including, among others, the translation services. InteropEHRate pilot tests have verified the new developed protocols, and they proved to be fast and secure as a healthcare provider requires. Thank you for following this presentation, and for an extensive view, please look at our work on the project site.